Hello, everyone. Welcome to our first video podcast of Sparrc. Sparrc, Sports Performance Assessment Rehabilitation Research Counseling Institute. And I am Sujatha Pugazhendi, CEO of Sparrc. And we've been doing audio podcast for some time. We've just moved to video podcast with Dr. Kannan Pugazhendi, the one and only sports medicine practitioner for 35 odd years. Am I right to say that?
Sure.
I have to say that because it's 35 plus years of this experience in the field of sports medicine, where this sports medicine was unheard, unknown, and none of us even knew what it could do to a lot of people who are not non-sporting population as well. Always people think the moment we hear sports medicine, it's for the sports group of people and sports population. But we don't associate it with normal group of people who are non-sporting population, who has never exercised or don't believe in exercise. What does it got to do with us is the question that we have. But we have a sports medicine center that is Sparrc spread across India in 19 locations. We started in Chennai first. The first center that we started was in 2006 in Alvarpet, and then it steadily grew to 8 centers in Chennai, and we have 12 in Tamil Nadu, which includes Madurai, Tirupur, Coimbatore. And we also have 3 branches in Bangalore. We also have a branch in Hyderabad, Mumbai, and Delhi. We have 19 branches. We are going to be expanding further. But the expansion comes because not a lot of sporting population come to us. It's a lot of non-sporting population that comes to us. I'm sure you're eager to listen to why the non-sporting population is coming to a sports medicine center. The reason is exercise prescription that we prescribe for not just pain management. Pain management is the first area that we concentrate. The other is lifestyle diseases as well. All sorts of lifestyle diseases that we have today, diabetes, hypertension, or obesity, cardiac illness. There are so many things that are through lifestyle that we attract as diseases, and exercise prescription can prevent us. Here we have Dr. Kannan Pugazhendi. I think he is known more than how Sparrc is known as, or any one of us, because he is the main man behind, and he's been guiding us in every little detail that we've been doing. And with his association, I've been grateful to run Sparrc and represent Sparrc here right now. And let's move forward. We're going to be listening to what is exercise prescription. Should we have a guidance of a physiotherapist or exercise professional or a doctor, or can that be done by anybody? What sort of exercises can be done? Or is it only for somebody who visits a gym, or can you do it at home, at your leisure, at work? Yes, there are a lot of things that we're going to be discussing. Over to Dr. Kannan. So here we have Dr. Kannan Pugazhendi. Dr. Kannan Pugazhendi, I'm going to be addressing you as doctor. And although he's my husband, I'm not going to be saying it, not addressing like how I address him at home, but let's just keep it professional and start with, yes, doctor.
No domination, right?
No domination.
Thank you.
All yours. Okay, so can you brief us where you started? As in, like, when did you ever hear the word sports medicine first?
Funnily, I didn't hear the word sports medicine. I saw the book on sports medicine in the Madras Medical College. So I was a student, and I was an athlete first, and I was keen on continuing my sports, and most of them discouraged me for, you cannot continue all this when you are going to be a doctor. But I wanted a specialty that can combine what I'm doing and what...
When this wasn't a specialty. It wasn't a specialty.
Because I've not heard the word sports medicine. This is maybe 1982, 83. Yes, I was in the third year student. So I saw this book on sports medicine. My jaw dropped because some word is sports medicine, is it? And no one told me. And I realized that the specialty doesn't exist wherever in the Madras Medical College, the second premier institution in the country and one of the premier institutions in the world. And my professors didn't, we don't know. So finally, I didn't have a teacher to even look up to and understand where I could start. So I have to go on my own. And that is the starting point of a sports medicine. And if you ask me, I thought this is a specialty. I wanted to be a
It
surgeon.
was not a specialty anywhere, any part of the world, isn't it?
No, at that time, perhaps in Russia, or perhaps behind what we call as the Iron Curtain, the possibility of sports medicine did exist. But as far as we were not having such an amount of exposure to the outside world, or a course for sports medicine, even in America or Europe, didn't exist at that time. So the only way that we could connect to anything outside here will be only US and UK, all the areas. But I looked around, and though we didn't have an internet connection the way we have today, in those days it's only somebody who has gone there and come back, a doctor who can give you some information, or books that give you some information, and we have to find out what can be done. That's the time that I'm talking about. So communications were not that great, and books too costly to buy. And in the Madras Medical College, there are no books, 1 or 2 books on sports medicine. Luckily,
So when you heard sports medicine, what did you associate? Even today, this is what is the biggest struggle. We have 19 centers to explain people what is sports medicine and why it is applicable for anyone. It's not just for the non-sporting population. Not sporting population, even the non-sporting population can visit the place. It's hard to say. But what did you first associate, and how did you bring it to the normal public as well?
See, I was an athlete, and I wanted to continue, and I thought the word sports medicine was intriguing. I thought I could combine these two. Didn't realize that I was only looking at medicine that will enhance the performance of athletes and treat injuries for the athletes.
So initially you thought you wanted to work only with athletes, and that's what your idea was.
I didn't want to work with the general population. I'm working with the elite of the elite, and that's going to be the athletes in the world, the Olympians, the people who go for the World Cup, and that's all I wanted. I didn't want to do anything less than that. But unfortunately, as you just put it in your introduction also, common impression is, even today in the medical community, with evolved sports medicine, they don't look at sports medicine as a specialty, anything outside sport, a sporting population. It's a very narrow spectrum, and Sparrc wouldn't have made any major stride, because the injury that you're going to see in a sports environment is much lower, and the pain that we meet out of 1,500 or even 2,000 people whom we meet every year in all the parts of India through Sparrc.
I'm going to correct that. That is a month. In a month, we meet about 2,000 people.
Thank you. So this is where I need a CEO who can run the organization.
I have to give you, but you have said it yourself. If it's like 2,000 people a month you've seen in all this 30 years, and I'm sure you've met a huge population, that exercise prescription in itself has been a tool that can help them in even getting out of their mental health, physical health issues. I'm sure you've seen that. So
true. So I realized that 10% comes from boxing, wrestling, kung fu, karate, Brazilian jiu-jitsu, name it, all the most dangerous sport that you can imagine. I have only 10%. And 90% comes from population that watched the sport, never moved a coffee mug, more than that perhaps. And if they have any other equipment that can bring it to the mouth and they could swallow, they would be more happier. So we realized that we have become an indifferent population towards our health, because it doesn't seem to deteriorate on a single day as an event.
Yeah,
it is a process. So in that process, they feel that they have not done anything wrong that can rob them of their health. So we are looking at a different picture of India is one country that has people who still have malnutrition, or people who are underprivileged. But there are people who ate when they are not hungry and didn't exercise at all, are into the spectrum of sports medicine, which the American College of Sports Medicine did talk about even then, is that people who require exercise to keep them healthy, that kind of group is not still aware that they require something to keep them healthy. They feel health is something that is granted. And if there's any problem with that, you'll go to the doctor. And the doctor will restore you back into health. So if you
That's the common idea of going to the doctor, isn't it? Yeah.
So my thing of managing injuries just got diluted because once the non-sporting population reached at the Y and started asking, hey, if you can fix a Formula One race car, I just want to be moving, man. I don't want a surgery on me. Can you do something about it? So I'm given problems that normally in a medical college, as they are taught, as this requires a surgical intervention. So I thought, okay, he says, I don't want surgery, then why can't I intervene? And when I intervened, I found the exercise prescription could work so well, like an aqua therapy that we designed to use a swimming pool and then start to work with their strength, core work, etc. We realized that we can avoid patients going through an unnecessary surgical intervention, or where patients can reduce the complications of their common diseases, which we considered as diseases that come from only a genetic background, nothing to do about themselves.
But basically a disease of inactivity.
Perfect. So I found that those who are inactive didn't even realize they are moving faster and faster towards the requirement of health support. Health is something that you give yourself, not the doctor gives it to you.
Yeah, but most of us, I would say this even when people come to a clinic and they ask us this question, people associate quality of life to health.
Yeah.
So they say, I've come by this car, I sit down in an air-conditioned place and, the whole day, or I bought an ergonomic chair that's keeping me comfortable. So they associate all of what they have, the quality of life or the ability to pick up the financial ability to pick up whatever they want, associate that to quality of life and therefore health as well. So there seems to be overlapping on all of these things, and then people think I am in the best health possible, but that's not health.